Yes, it is. At this point, we in clinics and hospitals, we have arranged a whole sort of measures to really prevent the hospital transmission of COVID-19. All the personnel in the clinics, in the hospital is wearing face masks, protection equipment. We are screening patients that are admitted to the hospital being symptomatic or asymptomatic for COVID. We are cohorting patients, meaning putting them together, the patients with COVID positive tests, putting them together in hospital wards. We are taking all the precautions to avoid the transmission of the COVID hitting the hospital or in the clinic. So if you as a patient have another medical emergency or some of the medical issues, it is safe and is recommended to attend to the hospital, to your doctor, to your clinic on time. We have seen that a delay in routine medical care, delayed in conditions that require emergent treatment can cause severe problems and can lead to some complications. So it is extremely important to recognize that and recognize that the risk of acquiring COVID in the hospital is extremely low. So you should feel safe to come if you need to come. If you test positive for COVID-19, you should plan to go back to work after 10 days of the onset of the symptoms of COVID. So you have to start counting from the beginning of the disease, 10 days. Now, it is recommended to have 24 hours of resolution of fever. So the fever has to be resolved for 24 hours. And then lastly, all the symptoms related with COVID, GI symptoms, respiratory symptoms, the congestion, the fatigue, we recommend to be resolved. So now be aware that when you have that 10 days of resolution of 10 days for the beginning of the disease, resolution of the fever for 24 hours, and resolution of the respiratory symptoms or the symptoms of COVID, it is safe to come back to work. The risk of passing the infection to a co-worker is extremely low, and this is the official recommendation of the CDC. Again, it's something different from some lingering symptoms of COVID. We have seen that some patients remain with low-degree cough, low-degree fatigue, and those symptoms linger for many weeks. However, for returning to work, 10 days seems to be a safe mark, and is completely safe from the transmissibility standpoint. So if you get in contact with somebody that for sure has been diagnosed with COVID-19, you should question yourself if you got in contact in close proximity with that person. So let me define first what is close proximity. So close proximity is you share the environment very close to that person, very close physical contact for in less than 6 feet of distance for more than 15 minutes of exposure. If that is the kind of contact, that's a close proximity. Now, if you have provided care for that patient at home, that's probably close proximity contact. If you share the utensils, the things, if you drink some food, or if you have very close proximity with that patient, that's actually a case that counts for close proximity. So if the patient, if a person has a close proximity contact with somebody with COVID-19 positive diagnosis, you should get into quarantine. Why this is important? Because you can develop symptoms in the next 14 days since the last contact. So the person should get into quarantine. Quarantine means to diminish, to don't get into contact with other people, stay at home, and try to arrange to work from home. You should minimize the contact with other people for those 14 days, starting since the day of the last contact with the patient. Now, you should be aware that you can develop symptoms of COVID in those 14 days and also contact with your medical care provider if you develop respiratory symptoms or some other symptoms related with COVID.